Today on the Dr. Oz Show.
We're back with leading dentist and oral health expert, Dr. Jonathan Levine, and we're about to show you two groundbreaking oral cancer screening tests that you need to know about. Terry's here to help. She volunteered her mouth very bravely. Thank you.
You're welcome.
You go to the dentist often?
I do.
Does it strike fear into your heart when you do see the dentist?
It depends on what they're doing.
It does, doesn't it?
It sure does.
Have you ever had a dentist, in your opinion, examine your mouth for cancer?
No, because you only get 15 minutes there.
All right.
When you make your appointment, you have a 15-minute appointment. So I would say no.
So I want to change that across America today. So the first oral cancer screening test is something we're going to talk about called the Velscope. But before you show me the Velscope, can you just show us what an exam looks like fundamentally?
Okay. So our normal examination, we really want to look at all of the soft tissues in the mouth. So I'm going to put my loupes on. Please put your head back a little bit. Open for me. Open me. And what we're looking at the lips. We're looking at the oral and buccal mucosa. Open real big. We're looking at the cheeks. We're looking at the oral pharyngeal area, the tonsil area, all the way in the back, right? And now stick out your tongue, and the traditional ways we use this gauze as a tongue lasso, we go right around the tongue, and we're able to see the sides of the tongue, underneath the tongue, towards the floor of the mouth, left, right, and we'll say ah, and we're looking for any unusual red or white spots, any dark spots in the mouth.
Now, that lasso you saw Dr. Levine put in, that's your telltale sign that someone's examining you. They don't need any newfangled technology. It's not expensive. It just takes a minute. You just saw the exam. So even if you've got 15 minutes, if you get the one extra minute, the 16th minute, it could save your life.
Absolutely.
Okay, talk to me about the Velscope. We got two technologies that are changing dramatically how we can quickly screen and identify cancers. This thing is really cool.
So the Velscope is a new technology, and it's a visualization tool, and it allows us to see the normal tissue and compare it if there's any abnormal cells. And it will highlight these abnormal cells early when it's dysplastic changes. What that means is when the cells are just changing from healthy to unhealthy.
You just so
let's get your glasses on. Oh, yeah, we're going to protect those baby blue eyes.
Elton John.
Okay.
Yes.
There you go.
Yes, she does.
All right. Come put your head back for me. Open for me. And we're going to look through. It's a narrow blue light.
I'm just going to put this on there so everyone can see as well.
A narrow blue light with special filters. And you see the green, the kind of apple green color. That means health. But when the cells start changing a little bit.
And let me show you an example of what happens when they do change. Here's the picture that we would have gotten normally. This is a normal eye view. It's just, tooth is here, and, you don't see anything too abnormal here. Well, notice this area looks a little bit indented. Look what happens in the Velscope. Instead of the normal green, you have that darkened area. So you all see that? Yeah. So it's very helpful to aid the eye in identifying that as not being normal.
Exactly. And when you see that dark area, when the clinician or the hygienist sees that dark area, now we know that we have some tissue that are dysplastic or even precancerous or even worse, and we know we have to take action.
Now, if there is abnormal tissue, there's a second groundbreaking test. And I love this again because I hate the idea of a doctor having to take a knife and scrape stuff that's not really bad in your mouth. And so this is a brush technique. If you don't mind explaining, it's called the oral CDX brush test. If you could demonstrate it, I think everyone should have this also. The back of your mind is a quick way of making sure you don't have anything going on.
This is a breakthrough that has hit dentistry. It's the oral CDX brush test with the laboratory testing after it. Basically, it's the equivalent of a pap smear for cervical cancer, and it allows us in the dental profession to painlessly test any cells that have been highlighted by our Velscope, or looking in the mouth and we're seeing any red and white lesions. And
you all see this
these
brush?
little bristles will rub up against these cells, pick up on the brush, and then the clinician then puts that on the slide and sends it out to the laboratory.
Can you all see that brush? Yeah. All right. Can you show how we would use it?
Yes. Okay. Please put your head back a little bit. Open for me. Now stick your tongue out and let's make believe there is a lesion on the side of the tongue. And all we're doing is placing the bristles into it with a little twisting action. And now the cells are up on these little bristles, and this is then placed on a slide.
Did that hurt, by the way?
No, not at all.
Okay, good.
Quick and easy.
It's placed here on the slide. We then fix it, put it back into the plastic case, and off to the laboratory, where they have highly developed microbiological testing data to figure things out.
Very good.
Let's talk about pap smears for a second. Pap smears have changed the face of a cancer that used to be the #1 killer of women, of all the cancers. Think about that. It went from being the leading cause of cancer death in America to now cervical cancer is number 14, I think, on the list. So if you can take a cancer that was striking the fear into the hearts of women across the country for good reason and basically take it off the radar screen as a cause of death, now I think we've got an opportunity to copy that here.
I believe so, too.
Okay. And I want everybody watching today to make sure that their dentist gives them the oral exam that we just demonstrated with Dr. Levine. In fact, I want you to demand it. You've got to be your biggest advocate. So that's the first tip to preventing oral cancer. Dr. Levine, take me through the rest of them.
Well, then limit your alcohol. Really limit your alcohol for sure. Avoid tobacco. Avoid UV rays. If you're using lip balm, make sure there's a high SPF in it. Make sure of that. And, of course, practice smart sex.
So can I extrapolate?
Safe sex.
Yes. Thank you. The alcohol, 1 drink a day, which we talk about as being beneficial to your health. If you're getting more than 2 drinks a day, it tends to increase the risks of these cancers and other ailments as well. Cigarettes completely out of any kind. In fact, tobacco out of any kind. But let's talk about safe sex. Now, I've beaten around the bush on this a little bit. Let me be very clear. What I'm talking about is a dramatic change in how we have sex in America. What I'm trying to say is that the practice of safe sex means that your partner has to wear a condom completely throughout the period of being together with them, or you've got to abstain from oral sex. Am I crystal clear on this? Yeah. Anything left to the imagination? No, we're all understanding this.
No,
all right?
I'm way on board with it.
You're on board.
Yep.
Right. From the moment you're together, it's got to happen, or you got to abstain from oral sex. Otherwise, we will have HPV transmission more and more into the mouth, and it's going to cause more of these oral cancers that we spoke about today. Thank you so much for letting us experiment in your mouth.
One question. Every 6 months should you have that? Because you goes every 6 months to the dentist.
To be safe, every single time you go to the dental office, your hygienist or your dentist is going to be performing an oral cancer screening examination.
Okay.
To be safe. But if you're going to the dentist only once a year, it has to happen at least once a year, especially today in our young population.
Okay. Very good. Fair enough. Yep.
Dr. Levine, thank you very much.
My pleasure.
To all my guests. We'll be right back, everybody.